Hey guys, Nick Drossos,
And Dr. Laurent here.
and welcome to Man Yourself Up.
And today we are going to talk about fillers for men.
Fillers for men.
Yes.
So my first question is, what's the difference between Botox and a filler?
Oh, yes, of course. Botox is a toxin that paralyzes the muscle. A filler is hyaluronic acid, okay, which is a substance that is clearly present in our body, okay, in collagen. So we can put that in any empty space, any hollowness that you have.
So anywhere in the body or just in the face?
I am talking about face, but
okay.
now there are in other, uses of fillers on other body parts. Okay. Well, for the face, we use fillers for years, from the 70s, from the 80s.
Wow.
We have different type of fillers. We have semi-permanent fillers, which are these. Okay. This is the line one of the lines that I use in my practice. Okay, we have many other lines that other practitioners use. I have other lines too, but today this is what I still have. So I use it for this today.
So when we're talking about fillers, is it what we see? I mean, this stuff.
Well, fillers doesn't necessarily mean dark face. A lot of young women might come for it, and they usually come and ask you for something that doesn't look natural. Myself, I don't practice dark lips. Because when I do something, I want it to be seamless. I want it to look natural on you. I want it to respect your proportions. So I've done fillers on men.
So what is the type of fillers that men do? Like, do men do the lips?
Yes, they do the lips. Yes, the lips, when you do them, they will look like you. They won't necessarily look like a woman. So some men might come to feminize their face. That's a reality that we see with drag queens. Some men might come to masculinize their face. Yes.
In what, so if I wanted bigger lips, I would get?
Yes, you can get bigger lips, a better Cupid's bow, a better M.
What's a Cupid's bow?
Cupid's bow is this here. So when the outline is more defined, we masculinize your face with it. But if you have a lot of volume, that might feminize your face. If you have cheeks, men usually have flatter cheeks, compared to women. We need better jawlines.
Oh, that's nice on it.
Exactly.
The jawline on a man, I could see that square.
We need the jawline, the square, the snatch ones. Those words are the words of my last patient for the jawlines. He came, he said, "Doc, I need snatch jawlines."
So like that really square.
Yeah, it's
so
really
how
square.
would you do that? That means you would fill up. You fill up over here.
No, the way that it's done, it's usually I will have a point of entry that I use a needle to guide a cannula just to fill the space that I need to fill. That's a procedure. But if you want to see this, I might do a jawline on you, and people will see me do your jawlines.
And literally, I'm gonna see this more.
You will see a difference. I will assure you. Wow. The way I do it, you will see a difference right away.
And how long is it gonna last? So let's say we do my jawline.
Jawline usually stays for 6 months to 1 year.
Wow.
Yes.
So one treatment, 6 months?
It's one treatment.
Is there any risks to it?
Oh, of course. Always. A lot of risks. Because it's a product that we use. Fillers, we have some regions that we need to, we warn patients before we touch them, even if we will take all the precautions not to have complications. Complications are usually rare, but a doctor need to always have the agent that will dissolve a product okay, which is hyaluronidase. If you need to fill someone, if you use a filler, you need to have that product with you, because if you have a complication, you need to turn back the clock.
Oh, wow.
Yeah, we can do that. So fillers can obstruct vessels. Okay, even in the lips, they can cause necrosis. They can make your skin rot. If you don't use them properly, if you push it in a vessel, okay, if you don't take the proper precautions.
So, but that's done from your side as a doctor, right?
As a doctor, this is my job to make sure that I am safe, that I'm doing a safe procedure.
Okay.
Okay. There are many practitioners out there that will do it. Okay. Some fillers are even used in plastic surgery, also, just to do, let's say, a nose job. They will use it on noses, but it's a very dangerous place.
Oh, wow.
Yes, but we use it. We make sure it's safe for you, it's appropriate for you. So usually places that are filled, let's say temporal region, nose, under your eyes.
Okay.
Yes, under your eyes.
So you're gonna
your eyes.
You're gonna do like
not necessarily the cheeks here, the tear trough.
So it's gonna take away like the wrinkles then?
Yes.
Okay.
The tear trough here, cheeks, usually for women or to feel any hollowness in men.
Okay.
Okay. Lips, jawlines, ears. Actually, yes.
Why,
People,
why would
a patient. I never had a patient myself for ears, but I had a history with a colleague who was actually a teacher to me. She explained to me that we can do ears if the lobules is flask.
Okay. Yeah.
You want it to stand more, so you just do
But
that.
how do you know, do I get Botox or filler? Is it like, do you decide like this is a better choice for you?
Well, it depends on what you want. Let's say if you want your lips done, we can do a procedure with Botox, which is called a lip flip, okay, to bring your lips out more. That's usually done in women, but men will come if you have a paper thin lip and you want a lip like mine. Well, they were not done. I was born like this. So you might want to do some fillers. But when you do a filler, what happens to you? People needs to think about it. The filler, what it does, it fills the space, but it attracts water in there too, so to give you the lift that you're looking for.
Okay.
So it's filled with water, basically. So yeah.
So it's interesting. So it's gonna last how long?
6 months usually.
Okay, so you do one treatment, 6 months.
One treatment, 6 months. Some people, let's say, we need, as a principle, myself, I have that principle that I respect proportions.
Okay.
When you change things, it's when the people start to look bad.
Right.
We don't need to change your identity. We need to optimize your face.
Okay.
That's what we do here. We optimize you. We make you look better. We make you well. Let's say that you are in your 40s. I don't need to bring you back to 20.
Yeah.
You lived it already. So
But you're gonna try to bring me back to 30.
35.
Okay.
Okay, let's say it works with your gray hair.
That's what it is.
I think it's,
I think when we look at like men's aesthetics, I think it's like, still respecting, like you said, I like the fact that you tell your patients, like, I'll make you look a little bit younger, a little bit better, but don't expect to look like you're 20.
Exactly. But it doesn't work.
It doesn't work, yeah.
With your age, your experience, and you look 20.
Yeah, it doesn't.
No, it's not. It's not proper. So what I do, I have patients in their 70s, patients in their 80s, asking for things that we can help them. They will still look 80, but a good 80. Not a dying one.
Yeah.
Dying 80 is not great.
And probably people are asking, what is the cost of this? What are we looking at? If
Depends on the practitioner. some practitioners will, charge you by region.
Okay.
Yes, some will charge you, let's say, lips is 800, temples as temporal region is dangerous. You can go blind easily.
Okay, that's important for people to
Yes,
know.
people need to know that. Some regions that you do can make you go blind because the vessels in your face, they all come from your jugular.
Okay.
Okay. And you have two regions that makes you go blind easily. Let's say this area, the nasal area here.
Okay.
You go blind quickly. And the temporal area, quick. So when we do these regions, we make sure that we don't fill up the space, just not to close that artery. One. The second thing, we make sure that we don't inject in the vessel itself.
Okay.
Because we might close that.
Okay.
We don't want that to happen.
No.
So that's the danger of it. But as a practitioner, I have my techniques. I have the good techniques to help my patients. And I do that almost every day. So.
And I guess the one thing is picking the right doctor to do this.
Picking the right doctor to do it, the right practitioner first, experience always, okay, and also the right type of filler for the right place. Because the filler that I would put in your temporal region or your cheeks is not the same filler that I will put in your lips because we have different thickness.
Okay.
Depends on the region that you use it for. If you want a thick product just to lift the tissues, okay? You want a thin product just to define the lines on your face. Let's say the nasogenial line here. We fill that up because this line is created by your fat pads that are, the structure of your face, that are deep, okay? They got displaced essentially with age.
Wow. Okay.
Yeah. That's what happens. And to proper optimize a face, you need to understand the science of aging.
Okay.
Yes, the science behind aging. So, yeah.
All right. I think I'm ready for a full makeover soon.
What are we going to feel?
PRP, Botox.
What are we going to feel? Tell me about it.
I think the jaw would be cool.
The jaw, yeah. The jaw.
I'm sure if men, when men look at this, that's one thing that they would probably.
Yes, they usually come for the jawline. Yeah,
it looks
like
nice.
jawline.
A nice
yeah,
jawline.
Looks nice. I had a couple clients that came for lips actually, but when you do lips, it goes inflamed for a couple days before you see the right result. The product itself takes 2 weeks to settle in. So you will have some inflammation. You won't look that good, usually. Let's say if it's the tear trough, it's under your eye.
Yeah.
We need to undercorrect it because the product itself will bring some water. So when that happens, if we correct it completely, you will have baggy eyes. We don't want that to happen, you know.
We want to look younger.
Exactly. Just yeah. We don't want to create any deformity.
Yeah.
So what I personally do as a practitioner, I optimize faces. That's what I do. That's my work.
So guys, if you want to optimize your face,
come see me. The link is down there.
Yeah, come see Dr. Laurent.
Yep.
And I hope you guys enjoyed this episode. And
with fillers for men.
Fillers for men.
Guys, some people will come forward. They will always ask us, well, do you think I should do my lips or do you think I should do anything? And I will always ask them, what do you expect?
That's true. At the end,
yes, you have to go with the patient expectations because we don't want to change your face after coming here. We want you to unlock your phone properly.
So guys, if you want to learn more, I'm going to put Dr. Laurent's link in the bottom. Make sure to check him out.
Just remember, guys, don't be shy. Let's let's talk about things that we don't usually do.